A traumatic brain injury is an insult to the brain, not a degenerative or congenital nature, which is caused by an external physical force that may produce a diminished or altered state of consciousness, and which results in an impairment of cognitive abilities or physical functioning. It can also result in the disturbance of behavioral or emotional functioning. The cerebellum is located above the brainstem and toward the back of the brain. It is responsible for the coordination of voluntary motor movement, balance, equilibrium, and muscle tone. When a person has a traumatic brain injury and the cerebellum is involved, the individual tends to sway and swagger when they are walking. Another sign is they have a tendency towards falling. They also have weak muscles, slurred speech, and the inability to perform rapid alternating movements. The frontal lobe is the emotional control center and home to our personality. It is involved in motor function, problem solving, memory, language, initiation, judgment, impulse control, and social and sexual behavior. It is the most common region of injury for a traumatic brain injury. There are two lobes, the left frontal lobe, which is involved in language-related movement, and the right frontal lobe, which is involved in nonverbal abilities. When a person's frontal lobe is affected by a traumatic brain injury, the loss of fine movement occurs, the arms, hands, and fingers are weakened, a person exhibits little spontaneous facial expression, their IQ testing is significantly lower, and they have an impact on divergent thinking, flexibility, or problem-solving ability. They may also have a dramatic change in their social behavior and the way they interact with others. The occipital lobe is the center of our visual perception. This lobe helps us to correctly understand what the eyes are seeing and is located in the back of the brain. Therefore, the occipital lobe is not as vulnerable to injury as the other lobes may be. For a traumatic brain injury, some of the signs and symptoms include visual hallucinations and illusions, defects in vision, difficulty identifying colors, word blindness or the inability to recognize words, and difficulty with reading and writing. The partial lobe is located near the back and top of the head. It is the location for visual attention, the location for touch perception, and also involves the manipulation of objects. The partial lobe allows for the integration of different senses and understanding a single concept. Some symptoms that are involved in partial lobe damage include the inability to attend to more than one object at a time, the inability to locate the words for writing, problems with reading, difficulty in distinguishing left from right, difficulty with doing mathematics, the inability to focus visual attention, difficulty with eye and hand coordination, and bilateral damage can cause Balance syndrome, which is a visual attention and motor disorder. The brain stem is located deep within the brain and plays an important role in basic attention, arousal, and consciousness. All information to and from the brain passes through the brain stem. It is vulnerable to damage due to how deep it is within the brain. Some of the signs and symptoms for a traumatic brain injury that involve the brain stem include trouble swallowing, difficulty with organization and perception of the environment, problems with balance and movement, dizziness and nausea, sleeping difficulties, and decreased vital capacity for breathing, which is extremely important. The temporal lobe is located near the side of the head and above the ears. Its main functions involve high-level auditory processing, and it holds the primary auditory cortex. It receives sensory information such as sound and speech from the ears, and it helps us comprehend and understand meaningful speech. It also helps us understand when we are talking to people because it makes sense of all the different sounds and pitches. The signs and symptoms involved with damage to the temporal lobes include disturbance of auditory sensation and perception, disorders of visual perception, impaired organization, disturbance of language comprehension, impaired long-term memory, altered personality and affective behavior, altered sexual behavior, selective attention to visual or auditory input, difficulty placing words or pictures into categories, and difficulty in recognizing faces. It also involves increased aggressive behavior. There are two temporal lobes, the right and the left. Some damage to the right includes decreased recognition of tonal sequences and many musical abilities, and involves the loss of inhibition of talking. For the left temporal, it includes decreased recall of verbal and visual content, disturbed recognition of words, and impaired memory for verbal material. It is important for teachers to give accommodations for students with traumatic brain injuries and all other disorders. For traumatic brain injury, the teacher can allow the student to audio record lectures for later playback. If two tests are scheduled on the same day, the teacher can allow the student to take one of those tests on a different day, in order to minimize the knowledge needed to be remembered. Exempt students from reading aloud in class due to impaired reading ability. Provide visuals in lectures. Have students receive peer notes from other students who take great notes, or allow students to copy the notes that you have. Allow the student to have extended time on both in-classroom assignments as well as tests and projects.